PregnancyChat.com and week 36. I'm Monica Healy. This week, your baby is the size of a honeydew melon. Well, if you can imagine baby all curled up. Okay, let's see what's happening with baby this week. All systems are a go. Your baby is weighing in at almost 6 pounds, 2.7 kilograms, but the inches are slowing down dramatically. Baby is nearly at his full height or thereabouts, just upwards of 18 inches, 45.7 centimeters, and baby continues to gain an ounce a day. She's gearing up for the big day with the majority of her systems in working order, including her immune and circulatory systems. Baby's skin is smooth and soft, but her head remains wrinkled and malleable to accommodate her growing brain, as well as the imminent squeeze through the cervix at birth. Baby's also shedding the downy hair, lanugo, covering her body, and the vernix, the white, waxy film on her skin. Baby will swallow both the lanugo and vernix after they have been discarded, as well as other secretions within the amniotic fluid, to build up meconium, a black, tar-like mixture that will result in her first bowel movement. There is a heap of brain activity occurring this week as well. She now recognizes the tones and rhythms of your voice and can distinguish yours from others. High-pitched noises seem to stimulate babies more than other sounds. In fact, a high-pitched sound may even bring about a facial expression from your little one. She is developing a greater range of expressions and practicing them during the time she is awake, which is more often these days. During these awake times, you may feel strong movements or even see body parts moving across the surface of your belly. Some women insist that they can identify which part of the baby's body is sticking out, whether it's an elbow or a foot. If baby is head down and dropping, the movements will be in the lower location, lower than usual. If she has not settled into the head down position yet, your practitioner may suggest an external cephalic version. It is a method to turn a breech or transverse baby into the head down position from the outside of your body. So what is happening with you this week? Has your honeydew dropped yet? The baby's descent toward the pelvis is known as lightning, and you may even feel a bit lighter as you will be able to inhale more deeply. Unfortunately, there will be even more pressure on your lower organs, causing frequent trips to the restroom and the inability to eat larger meals without feeling completely stuffed. If this is your first pregnancy, the baby usually drops a few weeks before birth, but if you've experienced pregnancy previously, sometimes the baby may not drop until delivery day. As your pregnancy progresses, your hips and pelvic muscles are becoming increasingly loose to accommodate baby's birth. This can be a painful process and can result in the infamous pregnancy waddle. If your baby has in fact dropped, then the combination of lightning with those loose pelvic muscles can give the feeling that you are walking with a bowling ball between your legs. Feeling restless these days? You are experiencing the same old symptoms: constipation, itchy abdomen, trouble sleeping, heartburn, fatigue. Your symptom list may grow if you are one of the women who develop restless leg syndrome, an uncontrollable urge to move one's legs due to a burning or tingling sensation in the calf, upper leg, or foot in the third trimester of pregnancy. This is not a dangerous ailment, but it can be extremely irritating. Massaging and stretching your legs can make all the difference in alleviating this annoying symptom. You can never be too prepared. In 1 week, you will be considered full term. With that in mind, it is time to tie up all those loose ends. Try to answer all the possible questions such as, what if I go into labor while I'm at work? Or what if my husband is away on a business trip, etc. Some women will not go into labor until well after 40 weeks, sometimes beyond 42 weeks, which is known as post-term. Either way, you will feel relieved if you are prepared. Inform your boss or co-workers of any projects you may be working on, and be sure to familiarize yourself with the process of maternity leave through your work site. If you took a childbirth class, you may want to review any notes or materials that you were provided. Practice breathing techniques. By breathing in a deep, slow, and relaxed manner, yes, it is possible even in the midst of the birth chaos and contractions. You will remain more controlled during labor. Your heart rate will slow down, and you will be able to focus on something aside from the discomfort of contractions. This is a perfect time to involve your partner, as that person may need to remind you to continue your breathing techniques through labor and help you focus. You also want to discuss a birth plan with your partner, such as whether you will be using pain relief, what kind, what if the doctor suggests a drug to get the pregnancy moving. Keep in mind that no matter what, this is your pregnancy, your birth, and your baby. You have the power to choose which route you will go. At the same time, complications can arise, so be flexible. Your doctors and nurses have the health of you and your precious baby in mind when they offer suggestions and intervention. Here are some tips for week 36, your birth plan. If you desire a birth plan, get it in order this week if you have not already done so. Pack your hospital bag if you do not have one yet. Many hospitals have lists of suggested items to include, but if you need added support, check out our fun hospital bag video. Your childbirth class may have included infant and child CPR. If it did not, this is an extremely important class that you will want to look into. For inexpensive options, check out your local YMCA, hospitals, and Red Cross organizations. Don't forget to review any labor and delivery information you have received, taking special care to focus on breathing techniques. Take some time to spend with your partner, family, and friends, because once your baby is here, your time will be limited. You may even want to consider a date night with your partner before your sweet baby arrives. So that's it for week 36. If you have any questions or comments, please join in the conversations in the forums at PregnancyChat.com. I can't wait to tell you what is happening during week 37. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Healy, and thanks for watching.